Welcome to the Nonprofit Podcast Network. Our purpose and passion are simple: to highlight the incredible nonprofits that make our communities stronger. Each episode is a chance for these organizations to tell their story in their words, sharing not just what they do, but why it matters to the people they serve, to their supporters, and to all of us who believe in the power of community. Through podcasting, we hope to amplify their voices, inspire connection, and give them one more tool to impact the hearts of donors, partners, and neighbors alike. This work is made possible through the generous support of our incredible partners: Cap Trust, offering fiduciary advice for endowments and foundations; Western Health Advantage, a local not-for-profit health plan that believes healthcare is more than coverage. It's about caring. CORE, executive leadership and comprehensive support services. They work in it so you can work on it. And Five Star Bank, a local, trusted advisor to community nonprofits for over 25 years. For more than a century, the American Heart Association has stood at the forefront of cardiovascular research, public health advocacy, education, and community impact. But beyond the recognizable name and iconic red heart logo is an organization deeply embedded in the systems that help save lives every single day. In this episode, I sit down with Suzanne Bartlett, Associate Executive Vice President, to explore the scale, reach, and mission of the American Heart Association. From the research and hospital protocols that have transformed cardiac and stroke care nationwide, to the grassroots education programs teaching children and families how to respond in moments of crisis. We discuss how the organization collaborates with hospitals, schools, churches, lawmakers, nonprofits, and corporate partners to improve health outcomes across entire communities. Suzanne also shares how Sacramento has become a national leader in support of the organization, especially our Women of Impact and Go Red for Women events, why volunteerism remains at the heart of the mission, and how the American Heart Association continues to evolve to meet modern health challenges. This conversation offers a fascinating look inside one of the most influential nonprofit organizations in the world, how it operates, how it raises support, and how it drives change, and why its work matters far beyond the walls of a hospital. Suzanne Bartlett, welcome to the Nonprofit Podcast Network.
Thanks, Jeff.
You represent not only an incredible organization, not only a behemoth of an organization with notoriety globally, but it's one that's really near and dear to all of us because it's about our hearts. And without that, we don't exist.
Right.
And I remember a conversation I had. It was a brain surgeon and a heart doc. And the heart doc goes, dude, it's called coronary for a reason, because you got no work if we aren't beaten.
Right.
And your brain does not control our heart.
Absolutely.
So it's really significant. People are familiar with the organization. The American Heart Association has been around a long time. Can you give us an idea, just a high-level overview of the organization?
Yes, absolutely. And so thank you for having me, Jeff. I'm thrilled to be here. Our organization has been around for 102 years. June 10th, we celebrate our Founders Day, and that'll be our 102nd birthday. And we're really proud of that because it is a testament to the legacy of research and science and quality programs that we provide across the country and in our local communities. Our goal is to bring health and hope to everyone everywhere and to create longer, healthier lives for those with heart disease and stroke. And it's so important because heart disease is the #1 killer of men, women, all humans, and stroke is the #4 killer. And so as we look around us, the stats show that 1 in every 3 people are suffering from heart disease. And that makes our work very important across the organization and every local community.
And in many cases, it's preventable.
Yes.
And education is premier. If you don't understand, you certainly can't do anything about it, but there's so many things that can be done. And I think that's the beauty of what the American Heart Association provides as not only an exemplar of things to do preventatively, but what to do if symptoms. The website is an absolute tutorial.
Right.
For everything heart-related.
It is.
Tell us a little bit more about that preventative posture that the organization takes.
Yeah, that's such a good question. The Heart Association believes that prevention is the answer. And so we have something that we call the Life's Essential 8. And it's 8 things that you can do to improve the quality of your health. And one of the things that I love about the Heart Association is we try not to just say, do not do certain things. We do say, do not smoke, eat in moderation, those types of things. But we also try to say, here are the things that you should add to your life. And so in those 8, Life's Essential 8, it's things like getting a healthy amount of sleep, of course, controlling your blood pressure and your cholesterol, but eating healthy fruits and vegetables, having color on your plate, right? Not just one type of food, as well as moving more, getting exercise. And we try to be realistic about that, I would say. I am not someone who's going to wake up tomorrow and run a 5K. It's just not something I love. And that's true for a lot of people. A lot of people are great runners and great athletes too, which is awesome. But we try to think about, how do you add things to your life? Like, how do you park farther away so you have to walk in more? Or how do you take the stairs instead of an elevator? So that you really can add those things in so that they become a small part of your lifestyle and build to being a bigger part, so that it's not so restrictive too. And so the Heart Association is doing that good work to teach about prevention. And more importantly, we want people to also know, what are the signs and symptoms? How do you know if you're having a heart attack? What should you do if you think you're having one? How do you advocate for yourself with a doctor? It's May and Stroke Month, and so right now we're really talking a lot about what are the risks and warning signs of having a stroke, because we're really focused on heart and brain health at the Heart Association.
And there's so many things that are relative to heart health. I mean, you mentioned eating and exercise and all that, but we're seeing a tremendous and very disappointing cascade of obesity in the country.
Absolutely.
And a lot of that's inactivity. And I personally think a lot of it's screen time. Screen time. Where you just don't get up and you don't exercise because you're either on a computer, you're playing games or whatever. And we're seeing it impact our youth, which doesn't help as they age. And people tend to think stroke, heart attack, old. And nothing could be further from the truth.
Right.
Is there an appeal? Is there a way that you're reaching out to those, let's say, under 40 for awareness? What are you doing?
So the Heart Association does so many different things. And one of my favorite things that we do is our Kids Heart Challenge. And that is our school-based program for kids and families, where we come in, we do an assembly with the kiddos, we teach them about their heart health risk, and they get little tiny characters that resemble each of those Life Essential 8 type behaviors that they can earn through doing different things. So one is they go online and they watch a video about how to do hands-only CPR so that they can be ready to act in an emergency with their family. We have them do jumping jacks every day, and then they earn a little character that's for Move More. And so we're educating kids through that way, and we know that within that goes home to the families. And so that's one of our approaches for people under the age of 40. We also have heart clubs in high schools and colleges where we're designing to educate and build that future next generation of people who care about their health and are meeting it at the beginning of their life. One of the things that our cardiologists often say is that once you get past 40, it's harder to change. As someone who is past 40, I'll say, yes, it's hard for me to, get rid of bad eating habits that I grew up with. And so we know that if we start young, that not only will that influence the parents, but also will create that future generation of just an attitude of health. We are lucky to live in California. I think about my counterparts and colleagues in the South. health is kind of the default on the West Coast in some ways.
And boy, do we know in the South, the levels of obesity are
Right.
just off the charts. And the food is so very different. When you
Right.
travel there, you can see a lot of fried foods and grease and not a lot of healthy eating.
Right. And one of the things that the Heart Association really has come to know over the last decade, I would say, is that where you live shouldn't determine how you live. And so our focus on making sure every community is healthier is so important because we want everyone to have access to healthy food, access to great health care, access to knowing your blood pressure numbers or your cholesterol numbers. And so that's important, and that's for everyone under 40 and over 40 because, as you said, awareness is key.
I'm going to ask you a question that's just organically coming up here. You may not know the answer on it, but relative to some of those gauges and those measures, meaning blood pressure and cholesterol levels, has that dynamic changed at all? Are the standards still pretty much the same, or are they finding new things to say this is important, more important, or equally as important to check?
Yeah, the real tent poles, I would say, for health are that blood pressure, cholesterol, and that's not changing. I think how often the care around those is changing and evolving so fast and quickly. And the Heart Association is a big part of that because we are writing the guidelines of care and really helping hospitals and hospital systems to know what that care should be. So I don't think the biometrics of it are changing. Those will stay the same for the most part, I think, forever. I think how we treat those is evolving so quickly, and the Heart Association is always looking at that science and funding great transformative science to make sure that those conditions can become easily treatable. And how do we live in a world where people don't want to take a pill every day,
Right?
or don't want to go to the doctor, or where you call Teladoc instead of going and sitting in front of a doctor more often than not. And so I think that's where it's evolving so much and where the Heart Association continues to make a big impact.
And where one of the concerns arises, too, is you mentioned people don't want to take a pill. There's other people who just want to take a pill.
Right.
Well, I don't need to exercise. I'll take a pill.
Take a pill. Or take a shot.
That's right. It's so much easier than, and the truth is it's easier. It's not as effective.
Yeah. A healthy lifestyle, we want everyone to have a healthy lifestyle. We also, if there are things that make it easier, that are scientifically backed, we're for that too. So it's really interesting right now in the world of GLP-1s. We're doing a lot of research around does taking GLP-1 reduce your risk for heart disease and stroke? And our early findings are yes. And so that's a great thing in our minds too for many people. And so, there are great treatments that can come in there and help with that awareness and prevention.
And the thing I think that people maybe don't recognize is you are the number one research funding organization in the world.
In the world.
So every dollar that's being raised for the American Heart Association isn't going to an event or going into a particular program or process. It's actually funding the research that allows us to learn how to better deal with this disease.
Absolutely. We've funded more than $6 billion in research since our inception. And in a world where you don't always know what's true, and you're not always sure what is accurate, there is a lot that we are a big brand that can be trusted and can be seen as a science. We find that we are advising people on the science and the health because we're such a trusted, knowledgeable organization that has that backing of 102 years of amazing research findings.
And with all those research organizations, as well as the teaching colleges, the teaching hospitals, where you're in with those doctors as well, with those cardiologists.
Absolutely.
It's a perfect segue coming off of what it is you do to the regionality of your responsibility, because we're here in Sacramento, we're talking about this greater region, but you are responsible for 10 states.
Yes.
And then as we chunk it back down into our region, we'd be talking Stockton, Modesto, Sacramento as the Tri-City region.
Yeah.
What do you see in terms of collaborative relationships? Who do you work with in the area?
That's such a good question. And, it's pretty broad when I sit here and think about it. We absolutely work alongside all of the hospital systems. And we do that through our quality care programs, where we are working alongside hospitals to ensure that if you are going to go in and have symptoms of a heart attack or stroke, you're going to enter the emergency room. And we've written the protocols that the hospitals follow to ensure that you're getting diagnosed right away and properly. So you're not being told when we think you are having a stroke, go sit in the waiting room for 2 hours, because time is muscle loss in your brain. We've written the protocols, and hospitals work alongside us to follow those. And so hospitals are a huge part that we work alongside, research institutions as well. But one of the things that I love about the Heart Association is that we really are mission focused in strategic areas to work alongside all of the areas of the communities. So we work in churches because we know that that is a place where people come. We often do blood pressure drives there so that people who don't have regular access to care on a Sunday when they're going to a place of worship can know if their blood pressure is high. And when we do that, I'm always so surprised by how high and untreated people's blood pressures are. And that's an important place where we show up, is in places of worship. But we also work alongside, we see ourselves as a convener of community organizations. So often we work alongside other nonprofits on our advocacy efforts to come together and collaborate so that it's not one organization against another. It's really, how do we pull together the American Lung Association or American Diabetes Association to be advocating for the right bills to be passed in the legislature? And then I would just say, a third place where we show up is in community organizations. We work with the Boys and Girls Club to make sure that, they know what to do if someone needs CPR, and other organizations like that, and the food bank to ensure that there's healthy food that we're providing to people, and that we can ensure that the food that we're giving is the right kind of food to help people live a longer life when they're under-resourced.
Yeah, that's even greater depth and breadth than I knew. And you're already permeating the schools because you get the kids educated, and the kids are going to take that information home. And we see that with a lot of the organizations that we talk with, especially food related and food in schools, because it's a problem, especially in our more disadvantaged communities where they don't have access to good food.
Absolutely.
Food deserts in the neighborhood, and then how do they get fresh food, fruit and vegetables when it's all around us?
Right, especially in California.
Right. Yolo County has the highest proportion of food insecurity. That's where we grow everything.
Right.
It boggles my mind sometimes in terms of what happens. With regard to all the services that you provide, and I'll say specifically for this region because it's going to be different in each of the 10 states that you service as well. But let's say right here, are there any programs that you see, and I don't mean funding programs, but programs that are more in demand, or you do more in this region than you do in some others that you service?
We, our school programs, our Kids Heart Challenge is really active here. We have about 220 schools in Sacramento that participate in that. And so that is huge for us. But the other programs that we have is we do a lot of work around Nation of Lifesavers. And that's the Heart Association's effort overall to make sure that everyone is ready to respond if someone around them is having a cardiac arrest and is able to start hands-only CPR. And so it's not the mouth-to-mouth, breath-to-breath, which we all remember, right? Or we see on TV shows, but it's literally the compressions that will keep someone's heart beating. And we want everyone to be ready to do that because about 90% of cardiac arrests happen outside of a hospital setting. So that means in the home. And so we are very focused in this area on ensuring that everyone learns how to do hands-only CPR. It takes about 2 to 3 minutes to watch a video. We teach it with a song that you do the beats to. It's 120 beats per minute. So You do it to the beat of Staying
Alive. I was going to say, I know, I've seen it. I've watched it on the website.
Yes, or if you're in my generation, you can do it to Ice Ice Baby, or there's even Beyonce songs that you can do it to. And so we try to really teach that. I would say that's one of the biggest things that we're doing in this community. And you'd be surprised how often we hear, I watched the video, or I heard about this from somewhere, and I saved a life because of it. We have a lot of kids that we hear that story from because we teach it in our school program. And, they come back and say, my grandpa passed out and I called 911 and did hands-only CPR.
Isn't that great?
It is amazing. And they feel so proud, and the family is, of course, so grateful for that.
Right.
But it really is changing and transformative education that's making a difference in our local community.
And I would imagine when you go to the schools, when you go to those 220 schools, congratulations, by the way, that's the greatest penetration of any organization I've spoken with to have their program in the classroom. Do you bring, what do you call?
Mannequins.
The mannequins, okay.
We don't.
I know I was going to use the wrong name, so I purposely was waiting for you to help me there.
I know. I always worry about using that, not saying mannequin too.
Right.
We call them Annie mannequins.
Okay.
Sometimes we do. What we found is that you don't even need to have the mannequin to learn. It's more about the compression rate that you do. We do bring in the mannequins. We do have school kits that we give to schools to use that can train the entire student body and train parents so that they know the rate of pressure to give, or the strength of it. But we just find that learning the compression rate, it makes the biggest difference of all. But we can't do that, and we do that. We usually bring the mannequins in for adults more than kids because they get more nervous. One of the great things about teaching kids is they're not afraid to react. Like, they just do it. Whereas we get nervous of we might break someone's rib, or maybe we shouldn't be touching someone, or what if we do it wrong? And kids just do it.
Yeah. Thankfully.
Yes.
I'm glad they do, because there's so many people that they can benefit from. And I can only imagine the pride of family and the child, if it was a grandparent or something like that. And, the youth comes up and says, I know what to do. I'll do it. Call 911.
Call 911.
How amazing is that?
It's so amazing. And the stories we hear are just so inspiring. And the Heart Association has always worked to write the guidelines for CPR and done training for CPR and been important. But it really has been since Damar Hamlin had his incident on the field that we have really begun to say everybody needs to know how to do hands-only CPR. And we want to build a nation of lifesavers. So if that happened somewhere around you, you can react and be ready.
And what I like about this conversation excuse me, is that everybody we're speaking to knows somebody. And in many cases, it's so prolific, we're probably speaking directly to somebody who has a condition, whether it's high blood pressure, cholesterol, has had a heart attack, or familial issues, diabetes. We all know those are impactful. Everybody knows they're impactful. AFib seems to be very popular. And atrial fibrillation, for those who don't know the abbreviation. But we're speaking to the majority. Over 700,000 people die from heart disease every year.
Yes.
And unfortunately, that number's not going down. It's going up.
It's going up. It is.
It's so important to get the messaging out and to get people thinking. And as they start to think, and those who have been beneficiaries of something that was cardiac related, it probably originated with the American Heart Association in some way, shape, or form, which leads to the next discussion I want to have, is that it's about funding. The organization doesn't exist without funding. How are you funded?
We're funded through private donors at corporations and the general support of the public. And so we take very little federal money.
Congratulations.
Very, very little. And we do that on purpose because we want our work to be independent and trustworthy in a way that is not based on federal funding. And so we as an organization raised $1.1 billion last year, organization-wide.
Wow, that's an amazing number.
It is. It's so exciting. I've worked for the Heart Association for 21 years, and it was our goal to be a $1 billion organization since I started. And so we accomplished that 2 years ago for the first time. In Sacramento, we raise $3.5 million annually, and we do that through our events. We have a Heart Walk. We have Go Red for Women luncheon coming up very soon, and we have our Heart Ball. And then we have things like our impact campaigns, and we have generous donors who are doing little events all around us to raise funds. And even we do the mailing label. My stepdad for years, he would do what we call the Dear Neighbor campaign. And he'd go door to door and say, do you want to support the Heart Association? We'll send you mailing labels. And so, we have a variety of ways that people can support us and do that amazing work to help us raise those funds to fund community programs, advocacy, and research.
And I would imagine that $3.5 million is a pretty good number for a market our size.
It is a great number.
And I'm going to lead you to another thing about a market our size, Go Red for Women, Women of Impact.
Yes.
We have a very visible personality, Anne Fong, who was a woman of impact.
Right.
And this year, I understand that Sacramento led the country.
Right. Anne,
it's amazing.
It is amazing. It's something I'm so proud of. It makes me smile. Anne is our national winner of Women of Impact. And that means that she gets to represent the whole organization of the Heart Association from the greater Sacramento area. And it's the second year in a row that we've had the national winner. Kat Holmes of Sutter was last year's winner. And it just is a tremendous thing that Anne and people like Kat do for us, where they really garner support from their networks and spread the message of the Heart Association and our work to who they know, in hopes that then the people that they know spread it on. And I'm very proud that Anne is our national winner. Anne should be so proud, but it is nice bragging rights for our region for sure.
I know when she was telling me, she was really excited because she gets to go to New York, and you got her a pair of red shoes.
Yes.
Which is very, very cool.
Yes.
And to think that Sacramento, a top 30 market in grand scheme of things, outpaces all these other major markets.
Right.
I mean, a Houston and a Dallas and a New York and a Chicago. I'm still baffled at how it happens, but I'm proud that it does, because the American Heart Association is such a recognizable entity. And for us to take that level of gift and giving really is a statement.
It's a statement to volunteers. We are a volunteer-based, volunteer-driven organization. And so we rely on people like Anne to help us. And what we find time and time again is people have personal connections, and the work is meaningful to them because it really is making a difference in the treatment and in the awareness for people that's so important.
We're going to skip a beat or two before we continue the conversation with the American Heart Association's Suzanne Bartlett to hear from those who make this program possible.
I'm James Beckwith, President and CEO of Five Star Bank. We're dedicated to supporting nonprofit organizations who advocate for the strength, resilience, and vitality of those they serve. When nonprofit organizations thrive, our community does too. By supporting the Nonprofit Podcast Network, Five Star Bank is amplifying the voices and meaningful impact of our nonprofit community. We're Five Star Bank, a trusted nonprofit partner. How can we help you?
We are really excited to be part of the family and contribute to the work that you all are doing. CORE provides fractional and interim executive services, along with comprehensive back office solutions that go into our client sites and do the work to give them the capacity they need in order to move through transitions, whether that's planned or unplanned. Or companies also work with our accounting and finance, back office solutions, human resources, technology, and administration. The reason why our back office solutions add value is because we save them time and money, anywhere from 20 to 30% of what they would spend on that back office solution. We work in it so they can actually work on it. CXORE.com and contact me directly at DTEAT at cxore.com.
If you're interested in learning more about how CORE may help your organization, visit cxore.com.
Hello, this is Scott Thomas with Cap Trust in our Sacramento office. I specialize in working with local nonprofits and associations. Annually, we survey private and public nonprofit organizations across the country to better understand challenges they see in today's environment. In our more recent survey, we heard concerns about proper board governance, mission-aligned investment, and how to implement alternative investments. If you would like a copy of the survey or to discuss your organization, look me up, Scott Thomas at captrust.com.
I'm thrilled to have Western Health Advantage partnering with us as they do so much to support so many nonprofit agencies in our community. As a truly local health plan, you'll find individual and family options, employer options, plans for CalPERS and Medicare Advantage. From medical services to pharmacy, health and wellness support, as well as behavioral health care, Western Health Advantage has a plan that fits what you need. As an employer, for profit or nonprofit business, individual or family, you can find more at westernhealth.com. Tell me a little bit about the process of identifying what you want to do when you're doing fundraising. How do you determine what's going to work? How do you determine who do you reach out to? Because it happens, a lot of your events are annual.
Right.
And here it comes again, here it comes again, here it
Yes.
comes again. How do you keep it fresh? How do we not get caught? So many nonprofits are stuck now with philanthropic giving of seniors
Right.
who are aging out.
Mm-hmm.
And that wealth transfer to the children, they're not as philanthropic.
No.
They're not as engaged. What's the American Heart Association doing to keep everybody engaged?
I think that is the benefit of being a large national organization that is still incredibly nimble. We are changing and innovating every day. You mentioned the Woman of Impact campaign that Anne was a part of. That's a program that's only 5 years old. And it came out of the pandemic when we were sitting and thinking about how do we reach this next generation? And so we innovated and came up with this program. But it's also a testament to our volunteers. We have volunteer committees locally, regionally, and nationally that we are always talking to and learning from what is new, what is happening in your industry that we need to be and stay relevant to. And then what I would say is our events apply to different pockets of the community in certain ways for a reason. Our Heart Walk is focused on corporations and employee wellness and knowing that we want to work alongside top employer groups to ensure their employees are healthy. Go Red for Women is focused obviously on women because women have a heightened risk for heart disease and stroke and are often not diagnosed.
Dismissed.
And dismissed
Gaslit.
by doctors, yes.
We do another program out of the studios, and it's amazing the difference in the way the men are treated versus the women.
Absolutely.
It's okay, honey. Here's a couple Valium.
Yes.
You'll be fine.
It's
Just relax.
anxiety.
It's the kids. Don't
Yeah,
worry.
you're stressed.
Yes. And in fact, it's not. And I know when a woman comes into a hospital, if she mentions chest pain, boom, it's
Yes.
right into heart protocol immediately.
Immediately. And that's a change in 20 years. Our Go Red for Women program is 22 years old now. And we started for that very reason, that women were not being diagnosed. And so it is to educate women, but it's also done a tremendous amount of research on what are the signs and symptoms for women? How are they different from men? And not only for women personally, but for doctors and medical professionals, because I am always surprised, and you'd probably be surprised how under-recognized scientific research on women is, and how, for a long time it's been general population research, and it really is, women obviously are very different than men, and so it has to be a focus as well.
On the topic of funding, let's have a little fun.
Okay.
20-some years you've been with the organization, so you've seen a lot.
Right.
As you look at it today, somebody walks in, grateful patient, and says, boy, if it wasn't for some of the research that you guys had done, I may not be here. Wealthy. I want to give you a blank check. Suzanne, give me a good enough idea to sign this thing. What would it look like? What would you like to see if money was no object?
I love this question, Jeff, because I think I do think about this a lot. What is our dream? What would be transformative forever? And we think about mammograms for breast cancer, or colonoscopies for colon cancer. And there are tests like that for heart disease that would really pre-detect before you had so much plaque build up in your heart that it couldn't be treated. And I would love for there to become a standard of care, a colonoscopy for heart disease that, at the age of 45, everybody has to go and have screening so that they would know immediately. And it would show them, the beauty of a mammogram for a woman is you can see what is going on and if there is something wrong. And I think people are so visual. And we can say your blood pressure is high, and people say, well, it's fine. I didn't eat right yesterday or something, or your cholesterol is high. But we really need something that shows people in a way that they can't brush off that heart disease is a risk for them and that they need to take action now. And so if there was a blank check tomorrow in the heart of hearts, that would be my dream of, how do we make a standard of care that people have to have this done by this age so that they know their risk and can do something about it.
I don't think we're that far off.
I don't think we
I
are
think
either.
we're close with what AI is doing and the predictive elements of what it sees from X age
right
to what might materialize based on all the data that you helped it acquire. I've read some things that we're close. You start early enough, and if you have these particular traits, then this is a likelihood change.
Right.
Now, it doesn't mean we're going to change people's behavior.
Yes.
We may educate them, but we know so many other things that it really takes a long time to get people to move. But I agree with you. I think that's a wonderful vision. And it's one of those that's not so far-fetched. It really is a reality. Back to reality.
Yes.
What is the greatest need today? What do you see the organization needing more than anything?
We always, I will answer that in two different ways. We always need more volunteers. As I started, I said, we are a volunteer-based organization, and that is at the heart of everything that we do, is how do we serve the communities? How do we stay relevant to the people who live around us? And so we always need more volunteers. We need more people around the table who want to educate, to make a difference, to come alongside and help. I think at the same time, the greatest need in these times that we're in right now is really that advocacy too. And that is something that everyone can do, is how do we help advocate for SNAP benefits to continue for the people that need them most, for healthy school lunches. And so
easily forgotten things,
but transformative.
But so important. Yes.
And so we need those advocates for us, and that kind of grassroots movement we rely on that will change the systems of care long term, because that's what is going to make the biggest long term difference, is these systematic changes. And then our research, rises up alongside that, and it just creates the perfect place where things can change and we can really identify risks and make changes.
In a small organization sitting across from me like this, I ask a question of impact, and they can demonstrate, this family, this child, this situation. In 20-some years with the organization, certainly you've seen a lot, and that impact could be in a variety of different places. It could be a change in behavior in an organization, in a hospital, in a healthcare system. But are there any stories, or maybe one story that's poignant that you recall or encountered to the benefit of an individual, to somebody we can put a face to that's not a research, data-driven thing? I'm sure there's many, but
there's many.
Could you share one?
I'll just share one personally. My nephew is 26
Oh, this
years
is very
old.
personal.
Very personal. And he was born with a congenital heart defect. And I'm his proud aunt, so I can say this. He had a hard life. He wasn't able to do sports. He wasn't able to do PE. And that made him, just different. And we all hate when kids feel different, I think. And so he grew up with a lot of different treatments, a lot of different in and outs of the hospital. And when he was 22, he had his valve replaced. Very young, right out of college. Huge surgery, was down for 6 months. Very scary time. If he was born today, he would probably have an in utero surgery to fix that defect and have a completely normal life.
In utero?
In utero.
Wow.
And that's because of research done in by the Heart Association in my lifetime, in his lifetime, that would just change the trajectory of my nephew's family and my husband's family. And we have lots of stories like that every day that happen. I would say I hear them all the time. But it's amazing what has changed in 20 years, too, that is life-changing for families, that they don't have to worry about those types of things anymore.
That's amazing to think what was a massive open heart surgery procedure can now be done in utero,
right?
Pre-birth.
Pre-birth.
I didn't expect that. I didn't know that existed.
Yeah.
And
lots of those things are treatable in utero now and detected. We didn't have the ultrasound capabilities that we had.
Right.
And so we have now. And so I do think there's a lot of different things. And one of the greatest things of my job is getting to hear stories like that, because you'd be surprised how many people have had a loved one that had a heart attack or a stroke. And, that because of great care and because of our research, they're doing fine. And that's a great thing to be proud of.
And that I agree. So many people today live past the stroke, live past the heart attack, because they're aware of early identification of symptoms. And we'd rather have you be wrong
Yes.
and get checked as opposed to uncertain
Yes.
and have a problem.
And call 911. Those are one of the things it works. One of the things that I hate hearing is people say, I thought I was having a heart attack, so I drove myself to the emergency room.
No.
Go by ambulance. Call 911. I know we always worry about bothering people or, having a hospital charge. If it saves your life, it's going to be worth it.
Right. Yeah. I mean, if you're not here,
Yes.
yeah, that's not a good option.
Right.
And everybody that's behind you too. This isn't just for the benefit of the individual. It's for the benefit of all the people around you who rely on you, who love you, who want to see you healthy.
Right.
And the significance of that just can't be understated.
Absolutely.
In so many ways. And the research that you're doing relative to intake, meaning what do you eat? How do you eat? What do you do? What's your lifestyle? Are such easily addressed situations. I understand they're difficult to actually execute, but they're easily addressed. And putting that team around you, whether it's even some of your volunteers who recognize an issue with somebody, who are there to support the individual too. Because I know it's not all just about the actual care and understanding, but there are people who you're working with, who your teams of volunteers are supporting, talking to, how are you doing today? Did you eat? Whatever it might be. And that makes such a difference too to that individual, because your people are familiar.
Right.
And they care and they understand. So it would be difficult for you in your position as American Heart Association to not walk down the street, because everybody has a heart.
Right.
And you look, and I'm sure some of it's processing, going, oh boy, that's not going to end well. There's a situation. You live it every day. We can't not see it. That there's also some weight to the organization. 10 states, a massive responsibility, and I'm sure in every single one of those states there's interests of expectation. Suzanne, can you? There's a way to get away from that, and we have this little segment now called Beyond the Mission.
Okay.
So let's take a couple of questions to give the audience an opportunity to learn a little bit about you.
Okay.
Okay, these are fast questions.
I'm ready.
Let's see how you do. Favorite color?
Green.
If you're going out on a drive, podcast, silence, or music?
Music.
Favorite song? Or band? I'll make it
Favorite
easier.
band? Okay, I'm a huge Noah Kahan fan. I have an 18-year-old, and so have just immersed myself in her music to be with her. But Noah Kahan would be my favorite.
It'll keep you young.
Yes.
I can attest to that.
Yes.
Early bird or night owl?
Early bird.
Favorite food?
Oh gosh, this is hard for me to answer because it needs to be heart healthy. I'll say
French fries aren't a good one, right?
I know. I will say moderation is key. So I would say my favorite splurge are nachos.
I give that as your guilty pleasure.
My
That's
guilty
one of the
pleasure,
questions.
yes.
TV show that you would binge?
So I'm a reality TV junkie that I'm embarrassed to say. So I am a binger of Real Housewives. Unfortunately, if I need to say like a quality show, I'll say like Ted Lasso, Shrinking, those, great Apple TV shows would be the
But
more
your escapist is?
redeeming type of shows. But yes, I escape in reality TV.
And then last question, what do you do? What grounds you when things get heavy?
When things get heavy. I am a walker. So I am someone when it's stressful or when things feel heavy, I like to go for a walk. Sometimes I take my dogs, sometimes I go by myself, but movement is good for my brain and my soul. And so I really try to just get out and move. And if the weather is bad, the weather's been so bad here in Sacramento lately. I am a housework person. And so I'll organize the closet or declutter. And that really just seems to ground me as a person.
Wonderful answers. I think some people may be surprised by a couple of those, right? Right.
Forgive me for the nachos.
Right. How does one support the organization? What's the best way to both learn more and do more?
So our website, heart.org, is the number one place I think that people should go. There's a lot of information, endless amount of information there. But if you go in, you can also enter your zip code and it'll take you to the local market, to the Sacramento market. And you can see the events that we have there that you can get involved, our advocacy efforts that you can become involved with, and volunteer opportunities. And so I would say it's the number one thing that people should be looking at. Also our social media. So our Instagram is AHA NorCal, and you can follow that and you'll see updates on our events, of things going on in the community, but also great tips of how to live a healthy life.
And I will put all that in the show notes as well, so it's easy for somebody to just listen and click, because if they're driving,
yes,
exercising,
don't write that down.
No, don't. We don't want you stopping trying to do something silly. And I will attest to the website. It is amazing. The amount of information in every segment, every question you've got is there.
Yes.
In such depth, and you can just keep going.
Keep drilling down.
A lot of us will identify something, go to the, Google it or AI it now with whatever your preference is for AI. But that website is so easy to navigate and so deep.
Right.
You really don't have to go outside of it. And I would imagine a lot of the resources that are being shared in other agents, so to speak, are coming from your website.
Absolutely.
Because it's all out there. Well, Suzanne, I just want to take a moment to recognize the extraordinary work that's being done by you and the team at the American Heart Association. Obviously, it's personal here because I live here, but advancing life-saving research, advocating for healthier communities, ensuring people have the knowledge and tools to live longer, healthier, happier lives. It's not easy, and it doesn't happen in a vacuum. You've got dedicated leadership. I've met many of your people. You have amazing resources with the docs in the community, committed staff, volunteers, supporters, and everybody's pulling in the same direction. So with all that in mind, helping our communities be better, thank you for the work.
Oh, thank you.
And for the heart you bring to it.
Oh, I love how you did that, Jeff. Thank you for your time, and thank you for your passion for our organization as well. We so appreciate it.
Appreciate you.
Thank you.
Thank you for listening to the Nonprofit Podcast Network. We hope today's episode inspired you and gave you a deeper look into the work of our local nonprofits. If you believe in our mission to amplify their voices, please take a moment to leave us a positive review and share this episode with a friend. It helps more people discover the incredible work happening in our community. And don't miss future episodes. Subscribe to our weekly updates and monthly newsletter at nonprofpod.com. And if you're part of a nonprofit that would like to be featured, we'd love to hear from you. Just visit the Guests tab on our website. The Nonprofit Podcast Network is recorded and produced at Hear Me Now Studio with generous support from our outstanding partners. CapTrust, fiduciary advice for endowments and foundations, online at captrust.com. Western Health Advantage, local care with community impact. Find the plan that fits at westernhealth.com. CORE, executive leadership and comprehensive support services. Visit cxore.com. And 5 Star Bank, a local trusted advisor to community nonprofits for over 25 years. 5starbank.com.